Intravenous therapy can involve pain for patients and stress for healthcare providers trying to insert the needle, but using an ultrasound-guided IV machine helps make the job a lot easier, allowing the provider to see exactly where that needle is going under the skin. The Royal Alexandra Hospital has one machine and will soon acquire 4 more, meaning fewer pokes and less pain for more patients. The technology is especially useful for those with deeper veins.
A lot of patients who've received chemotherapy in the past are going to be definitely having more trouble getting having IV starts. Usually they traditionally have to get a lot of pokes before we end up getting an IV in.
All 5 machines are courtesy of the Marash family and their company, MHCare Medical. They have donated a total of more than $200,000 to help people like their father, who was a patient at the hospital.
It's quite heart-wrenching as a care provider to watch your parent go through additional suffering. This particularly happens when they are unable to find the needed vein.
Oftentimes, it's donor dollars that really are the innovation budget in our health system. So we have to say tremendous thanks.
The technology also shortens the wait time for IV insertion and reduces the risk of infection.
Over the last few years, things have been hard in the hospital for our staff, and for the first time in a long time, we're hearing people being excited about learning something new, being excited about making a difference for patients. We're taking care of our people to get them back to taking care of the patients, and it's so nice to have this reinvigoration and energy for our people to learn something new to really help patients. And this is something that we do every day. Everybody, this will be used every single day and will impact many, many people. So I actually couldn't thank you anymore. It's a huge, tremendous gift, so thank you so much.
To meet 3 generations of the Marash family and extend our thanks for everything that you have done to support the Royal Alex. And I know that you're a very close family. I can tell that just in the ways and the conversations that I've had with Sam and how he refers to his family, and he speaks about his sisters, and he speaks about his kids, and he speaks about his parents. And I can tell that this is a family that has as much charity in it as it does love. And it's wonderful for us to see that and to have a small part in that and to be able to say thank you for all of that. So, you know, this is not the first gift, as many of you know. This is really a second large gift to our hospital. The first one was in September of 2021, back in a very difficult time, as we all know, in the hospital, when the pandemic was probably at its height, and it was a difficult time for our healthcare teams. And so the donation that you made was really inspiring at just the right time. And so we were able to celebrate that in a big way. At the time, we did the check presentation. If you remember, Sam, it was outside. Remember, we were outside on the campus, all still outside, even with our masks. And but it was very special. And it was from that gift that supported respiratory care and supported a number of items that the hospital needed, a number of pieces of equipment, as well as our patient provider experience office, which is the office where we work on building culture in the hospital, a culture of caring and communication and doing things better and better listening. That's what that office does. And so that's really important too, because that impacts the entire campus and makes such a tremendous difference to everyone. So that was the first gift. And that first gift was one of the pieces of equipment was, of course, the ultrasound-guided IVs. And it was that gift that really was the catalyst for Leanne and members of her team to say, this is important, this is making a real difference. It would be terrific to have more of these. And I have to say, thank you so much, Sam, for ensuring that the door was open for us to come to you and say, you know, you've made a real difference here, but this is also what the hospital would like to have. And where it now is saying it could make a real difference. So you answered the call, and you were very generous. And we can't thank you and your family enough for what you have done. And yeah, thank you. It's, yeah. I'd like to ask Sam. Sam, would you please come up and say a few words? That would be great. Thank you.
Thank you, everyone, for attending. Super happy my parents are here with us, my son and my sisters. Thank you to the Royal Alec and the Foundation for putting this together. You know, unfortunately, my father's been in and out of hospitals quite a bit. And at times, it was outside of the country because they travel. So we've seen different hospitals in different countries, and I gotta say, we're today standing in what I deem probably one of the best in the world. All left starting with the foundation and then in the hospital. This is a world-class facility. I go back to the pandemic and you say the unfortunate time, 2021. My father required hospitalization. There was a lot of uncertainty. His age, he doesn't speak the language. We were quite concerned to bring him to the hospital, so we kept him at home for as long as possible. There came a time where we had to bring him to the hospital. And I remember bringing him to the emergency room. I was told that, I have to leave him here alone. Very concerned and very worried as to what this man that doesn't speak English is going to do there. So I went and stood on the ramp outside, and I was quite upset and sad. The nurse came up to me and said, "What's wrong?" I said, "I'm worried about it." She looked at me and she goes, "Baba's going to be fine." And Baba was fine. So thank you to the frontline workers for the great work they did during the pandemic. It's awesome. They not only were frontline workers, nurses, doctors, but they were also family because they acted as family to us. Family wasn't allowed to come in, so they were the family taking care of the patient. So thank you very much to them and all the work they did. You guys' hospital is amazing. And it gives us great pleasure to support the foundation. We're going to continue supporting the foundation. And we look forward to working with you, Charlene, and your team. Keep up the great work. You guys have a great facility.
Donations like this actually make the difference from an innovation perspective at our facility. We want to deliver the right care in the right place at the right time. We're not going to cause, prolonged issues in terms of procedures we don't have. And this is just one more tool in our toolkit to be able to do that in a really effective and efficient way. So, thank you very much. That's really all I have to say. We appreciate the donation, and thank you very much.
Here at the Royal Alex, my grandfather has received life-saving treatment here. So out of our gratitude to the kindness and compassion that was shown to him, we love to give back to the Royal Alex Hospital.
The rapid response team was being called about 100 times a month before this dawning of this education that Robert's been spearheading. And it's really nice to see that those numbers have decreased quite immensely. So our rapid response team can actually respond to the more urgent needs that it needs to respond to. And our educators and our nurses are actually more confident in the practices that they would have to perform on a daily basis.
Your efforts are going to make such a difference. More machines means more ability to tackle this, means less patient negative outcomes, means healthier population in general.